Good morning, everybody. I am Princess Jalti Evangelista. I'm one of the members of the Group 11 together with Ayasa Villaforte and Hannah Joy Betonio. So, our topic would be all about international health services. So, international health services. It is a system of health institutions that provide health services to people living in different regions, continents, or around the world. The essential function of the international health service is to produce international public goods that transcend the border of any given nation. The nature of the international health and medical services, or the IHS, works with government and related agencies to provide healthcare services in challenging environments which often require targeted and tailored solutions. So, this includes the provision of health services in the rural and remote regions and overseas. So, in immigration detention facilities also, and in community detention and in correction of facilities. So, the International Health Service has vast experience also in operating in politically sensitive environments, which often require rigorous levels of reporting and scrutiny as well as attracting a high degree of interest from a variety of stakeholders. So also, the International Health Service staff come from a broad range of clinical and cultural backgrounds with experience delivering health services in challenging environments. So this workforce diversity helps to ensure the application of cultural sensitivity, compassion, and patient-centric care to the client groups. So the IHS works with governments and non-government organizations to help build the capacity of under-resourced local health service. The goals and objectives of the International Health Services. So the International Health Services, or the IHS, is in charge of coordinating the daily activities of the foreign and fly-in patients. The main functions of this unit are as follows. First, the patient referrals, the payer coordination, the patient navigation, clinical documentation, logistics and accommodation, and patient recovery and continuity of care.
International health agencies and their services. First, what is multilateral agencies? This term means that funding comes from multiple governments and is distributed to many different countries. First is World Health Organization, directing and coordinating international health activities and supplying technical assistance to countries. They develop norms and standards, disseminates health information, promotes research, provides training in international health, collects and analyzes epidemiologic data, and develops systems and monitoring that evaluates health programs. Next is World Bank. They loan money to poor countries on advantageous terms not available in commercial markets. The amount of money loaned to developing countries for human resources has increased steadily over the past 10 years, from 5% of total loans in the early 1980s to 15% in the past 2 years, with a projected 50% increase in human resource development loans over the next 3 years. Next is UN Economic and Social Council. First is UNICEF. It is a UN agency responsible for providing humanitarian and developmental aid to children worldwide. Their services are health in emergencies and humanitarian settings, strengthening health systems, and child and adolescent health and well-being. the United Nations Population Fund or the UNFPA. They spent about $130 million of its $260 million budget for 1994 on family planning programs, with with 59 priority countries receiving 70% of this money.
So now I will be continuing the topic on UN Economic and Social Council. So last for that is the United Nations Development Program or UNDP. Its major health concerns are AIDS, maternal and child nutrition, and excessive maternal mortality. Now we discuss World Bank Group. It supports countries' effort to achieve universal health coverage through stronger primary health systems and provide quality, affordable health services to everyone regardless of their ability to pay. So their services are new trust fund for disease outbreaks and mitigating COVID-19 impacts in health. So now we discuss about bilateral agencies. Bilateral agencies are governmental agencies in a single country which provide aid to developing countries. For example, France concentrates on its former colonies and Japan gives mostly to developing countries in Asia. So there are two bilateral agencies. Number one is the U.S. Agency for International Development. USAID's global health efforts grounded in investments in health systems, strengthening, and breakthrough innovation are focused around three strategic priorities. So their services are controlling the HIV/AIDS epidemic and combating infectious disease. Number two is the Danish International Development Agency or DANIDA is the official development cooperation agency of the government of Denmark under the Danish Ministry of Foreign Affairs. Its service is for the National Program for Control of Blindness or NPCB. Now we move on to international non-governmental organizations or also known as people-to-people aid. International Red Cross and Red Cross Crescent Movement. It is the largest NGO and its mission is to alleviate human suffering, protect life and health, and uphold human dignity, especially during armed conflicts and other emergencies. They have three components, which are number one, the International Committee of the Red Cross, number two, International Federation of Red Cross, and number three is the Red Crescent Society.
So, the seven fundamental principles of the International Red Cross and Red Crescent movement. So, first is the humanity, the impartiality, neutrality, independence like autonomy vis-a-vis national governments, voluntary services, unity, and for example of this unity is for each country only one national. So, next fundamental principle is the society. So, open to all, serving entire country, or the universality. The International Red Cross and Red Crescent Movement services. So first service is that climate. So a related extreme weather events and COVID-19. A first look at the number of people affected by intersecting disasters. Next is the polio program, transition in South Sudan, an assessment of risks and opportunities. Next is the World Vision. It works in developing communities to bring health and a full life. So its services are health and emergencies like disease outbreaks or epidemics. It can either be airborne, person to person like influenza, meningitis, measles, Ebola, Marburg, and waterborne like cholera, ABD, AWD, poliomyelitis, typhoid, and leptospirosis. So it can also be vector like dengue fever, Zika, yellow fever, malaria, and leishmaniasis. Um, Another service is that infectious diseases, all about the infectious diseases, like health and AIDS programs, like World Vision's focus, getting to zero for children. Another service is that the International Health Service is a system of institutions that provide health services to people living in different regions, continents, or around the world. The essential function of the international health services. That is all. Thank you. Here are our reference in the next slide. Have a great day.